Definitely being out in the trenches in Jackson is a very valuable place to do your training. I don't think you can learn anywhere outside of big county hospitals because you've seen everything. And the focus there is more on reconstructive procedures, not on cosmetic procedures. But you need to have a cosmetic eye to do excellent reconstructions, because when you're doing a reconstruction, you're not only thinking about function, but you're also thinking about form. So a lot of the focus, especially from the plastic surgery standpoint, is really making beautiful reconstructions. And I think that having more complex patients and having the opportunity to have things that are in a less controlled setting and have less choice over which patients you're operating on, which types of operations you can do, really develops and hones your skills. So in many ways, coming out of that environment and going to a setting like this, where you have healthy patients who are coming for a variety of different reasons, but under much more controlled settings, actually gives you a lot more tools to work with. I don't know if you've ever seen Dr. 90210. There's a doctor on that, Dr. Matlock. He's the guy who does all the laser vaginal rejuvenation. We brought laser vaginal rejuvenation to Strax. We had Matlock fly out and actually do a private course for 5 of us. And so one of the big new trends is vaginal rejuvenation, and more specifically laser vaginal rejuvenation and designer laser vaginoplasty. And that's something that we brought from Beverly Hills to South Florida. There are 2 types of vaginal rejuvenation. There's external vaginal rejuvenation and internal vaginal rejuvenation. External vaginal rejuvenation is really more concerning the cosmetic appearance of the outside of the structures. Sometimes people have asymmetry, sometimes people feel uncomfortable when they're in tight clothing. We really oftentimes are just there to kind of make things look a little bit prettier. As far as internal vaginal rejuvenation, that is usually more for women who have had multiple children, who are feeling that the structures inside are not quite as strong and don't have as much support, they're not as tight as they were in the past. Sometimes that can affect sexual gratification. Other times people can have a small amount, they can lose a little bit of urine if they're coughing or if they're laughing, and we can repair that as well. It affects both partners. A lot of times the women just don't feel much sexual gratification because they don't have a sensation of tightness or fullness or support of the pelvic floor. The other thing is that we're using the laser, and the real big difference between using the laser and the other techniques is that the laser makes very clean incisions, and there's less damage to the tissues around the incisions, so things heal faster, the scarring is less. It's a definite improvement over the more traditional techniques. The other thing that we're doing is actually the G-shot. I don't know if you've heard about the G-shot, which is G-spot amplification. The G-spot is an anatomical structure. It really does exist. It's about 2 to 3 inches inside on the anterior wall of the vagina. It feels a little bit like the roof of the mouth. It's got a little bit of a different texture. And in 87% of women, when we inject a small amount of a filler, very similar to the fillers that we would inject in the face, we make that area a little bit more prominent. In about 87% of women, they'll actually have more gratification. There's an 87% satisfaction rate with that. It basically helps women identify that region a little bit more easily. To call yourself a cosmetic surgeon doesn't necessarily mean that you even have any formal training in cosmetic surgery. To be called a plastic surgeon means that you had to go through, most people go through another residency training before. The majority go through general surgery. I actually happened to go through head and neck surgery and facial plastics before I went to general plastics. And then you have to complete another 2 or 3 year residency just in plastic surgery. And then there's a process that takes about 3 years after that where you get a board certification. Almost all of our surgeons are board certified, in fact all of them except for one who's still early in his career. So I think the big advantage of coming to a place like this is that we're all plastic surgery trained, which means that we're trained in plastic and reconstructive surgery. We've all done a legitimate residency that's accredited. And so we're not dermatologists or family practice or geriatricians or general practitioners dabbling in plastic surgery. We're people who are trained to focus on that. I think one of the greatest things about working in Strax, especially a young, energetic physician like myself, is that there are so many people here who have so much more experience so many more years of experience that if I have any difficult cases or complex cases, I can always count on getting 5 or 7 different opinions. And that, for me, has been something that's really helped me grow very rapidly and develop my practice. And vice versa. I think having younger physicians here also injects novel techniques and a new energy back into a practice, so that the benefits go both ways. Luckily, in this patient population, most people are very healthy. Most surgeries are relatively straightforward, but sometimes things can be difficult. There may be anatomy that doesn't look familiar. Sometimes it's just good, after you've been in surgery for a while, to have another set of eyes look at the same place, because 2 different people, especially fresh eyes, can see things in a new way. So it's very nice to know when we're operating in a center where everybody around us is also a plastic surgeon. They've all got different experiences, and they all have a lot to offer. And so it's not incredibly frequent, but sometimes we will consult with other physicians, a lot of times before surgery, but even intraoperatively. It's nice to be able to know that you have somebody who can come in and take a look. A lot of times I'm actually the one who's called into the operating room. I don't have a general surgery background. I have a head and neck surgery background. Sometimes when people are doing a rhinoplasty or complex surgery on the nose, there'll be a structure internally in the nose that they're concerned about the function, or they want to make sure that it's not a tumor or things like that. So a lot of times I'll be called in as a second opinion. Sometimes the anesthesiologist will call me in to evaluate an airway as well. I was head and neck surgery before, and I did a lot of facial plastics, cosmetic surgery in my training. I did a lot of cancer surgery before I started doing cosmetic surgery, and very challenging and very gratifying. But what I found is, as the years went on, we would do our big surgery and we would get all the cancer out, and then we would sort of leave at 3 or 4 in the afternoon, and the plastic surgeons would come in not having any idea what they were going to find or what they would deal with, and they would basically on the spot problem solve, use a lot of different tools and a lot of different techniques that they had, and you'd come back the next day and they'd have reconstructed the patient. So I became increasingly fascinated in that part of the procedure. It seemed to be more creative, and it spoke to the more creative side of my personality. As the years went on, and as I was doing more and more complex cancer surgeries, I became less and less satisfied with leaving after the cancer was out. I felt that I really needed to stay on and continue with the other team and take the surgery to its completion. Rather than just doing subtraction, I really felt that I needed to add more and help the patient reach a state of completeness and wholeness.